Every minute, a precious life is lost to malaria in sub-Saharan Africa. But what if a simple, age-old practice could become the unsung hero in the fight against this deadly disease? Imagine if the traditional way mothers carry their babies could be transformed into a powerful shield against malaria-carrying mosquitoes. Sounds like a far-fetched dream? Well, groundbreaking research just turned this vision into a stunning reality. For years, the U.S. military has been onto a secret weapon against malaria: insecticide-treated uniforms. These specially designed clothes have been a game-changer for soldiers stationed in malaria-ridden areas, significantly reducing the risk of mosquito bites and, consequently, malaria transmission. But what about the most vulnerable populations, like babies in sub-Saharan Africa, who aren't exactly issued uniforms? Dr. Ross Boyce, an infectious disease physician and malaria researcher at the University of North Carolina at Chapel Hill, posed this very question. Boyce, who used to wear those protective military uniforms himself, wondered, if it works for soldiers, why not for babies? But here's where it gets controversial. While insecticide-treated bed nets have been a cornerstone in malaria prevention, protecting infants during the day when they're carried around by their mothers has remained a glaring gap. It's almost laughable how obvious the solution seems in hindsight, Boyce remarks. The answer lay in the traditional baby wraps, often called baby carriers, that are an integral part of daily life in sub-Saharan Africa. These colorful fabric slings aren't just a practical way for moms to carry their little ones. They could now become lifesavers. Boyce and his team embarked on an ambitious journey to test their hypothesis in the real world. They conducted a large-scale, randomized controlled trial in rural western Uganda, involving 400 mothers and their infants aged between 6 and 18 months. The setup was straightforward, yet ingenious. 200 babies were wrapped in permethrin-soaked carriers. Permethrin is the same insecticide used in military uniforms and bed nets, while the other 200 were given carriers soaked in plain water. Every participant also received a brand new insecticide-treated bed net, the gold standard for nighttime protection. For 6 months, these young participants visited clinics every 2 weeks for malaria checks and tests. The researchers were meticulous, even retreating the wraps with permethrin every 4 weeks to ensure maximum efficacy. We wanted to know, without a shadow of a doubt, if this approach could work, Boyce explains. And then, the results shattered expectations. In the group using permethrin-treated wraps, only 34 babies tested positive for malaria over the 6 months. Compare that to a staggering 94 cases in the group with water-soaked wraps. That's a 65% reduction in malaria incidence. A figure so dramatic, it left even the researchers breathless. Thomas Eisel, a malaria expert from Tulane University, not involved in this study, calls it surprisingly large and points to a critical implication. Mosquitoes are biting infants far more often during the day than previously thought. We've been stuck in a rut with our existing tools, Eisel admits. Innovations like this are exactly what we need to break the deadlock. Now, before you start imagining a future where every baby wrap doubles as a mini hazmat suit, let's address the elephant in the room: safety concerns. Permethrin, while effective, can be toxic in high doses, raising red flags about skin absorption and potential neurological effects. But here's the reassuring part. When used on fabric, the transmission risk through skin contact drops dramatically, especially since babies were clothed underneath the wraps. Sure, about 8.5% of the permethrin group babies developed mild rashes, compared to 6% in the control group. But Boyce emphasizes nothing is zero risk. The trade-off is clear: a slight chance of a rash versus the very real risk of malaria, which is devastating for children. Of course, the study's controlled environment, with wraps retreated every 4 weeks, won't be practical in real-world scenarios. But that's where technology steps in. Manufacturers are already developing long-lasting permethrin-treated fabrics. Imagine a future where mothers receive these miracle wraps along with vaccinations at clinics, arming their babies with protection even before they take their first steps. Edgar Malogo, a Ugandan researcher and co-author of the study, predicts sky-high demand for such wraps. During the trial, he witnessed firsthand the eagerness of mothers. When the children were under the wraps, they were not getting bitten, one participant proudly shared, a testament to the wrap's silent, unseen yet powerful protection. So, here's the question for you. Is it time to redefine traditional practices as cutting-edge malaria prevention tools? Should governments and healthcare systems prioritize distributing these treated baby wraps, especially in high-risk areas? We want to hear from you. Do the benefits outweigh the minimal risks? Will this innovation be the turning point in the fight against malaria? Or are we overlooking potential downsides? Share your thoughts in the comments below. The battle against malaria just got a lot more interesting, and it's about to get a lot more personal.